Here are 10 USMLE-style pharmacology questions related to neurology, complete with explanations and answers. 1. A 72-year-old man with Parkinson's disease is prescribed carbidopa-levodopa. What is the primary function of carbidopa in this combination therapy? A. Increase dopamine release in the brain. B. Prevent central dopamine breakdown. C. Reduce peripheral levodopa metabolism. D. Enhance dopamine receptor sensitivity. E. Increase dopamine synthesis in the brain. Answer C. Reduce peripheral levodopa metabolism. Explanation. Carbidopa inhibits dopa decarboxylase in the periphery, preventing the conversion of levodopa to dopamine outside the brain. This increases the availability of levodopa for central conversion to dopamine, enhancing its effectiveness and reducing peripheral side effects like nausea and hypotension. 2. A 34-year-old woman with epilepsy is started on a new anti-seizure medication. She later develops gingival hyperplasia. Which drug was she most likely prescribed? A. Carbamazepine. C. Valproic acid. D. Levetiracetam. E. Lamotrigine. Answer B. Phenytoin. Explanatoin. A voltage-gated Na+ channel blocker is associated with gingival hyperplasia, hirsutism, and teratogenic effects, fetal hydantoin syndrome. Chronic use can also lead to megaloblastic anemia, osteopenia, and neuropathy. 3. A 65-year-old woman with Alzheimer's disease is prescribed an acetylcholinesterase inhibitor. Which of the following is a common side effect of this medication? A. Urinary retention. B. Dry mouth. Diarrhea. D. Hypertension. E. Weight gain. Answer diarrhea. Explanation. Drugs like donepezil, rivastigmine, and galantamine ster increase acetylcholine levels by inhibiting acetylcholinesterase. This enhances cholinergic activity but can cause nausea, vomiting, diarrhea, and increased gastric acid secretion due to parasympathetic stimulation. A patient presents with acute migraine and is prescribed sumatriptan. What is its mechanism of action? A. Blocks dopamine receptors. B. Inhibits COX-1 and COX-2. C. Stimulates serotonin 5-HT1B1D receptors. D. Blocks histamine H1 receptors. E. Inhibits voltage-gated calcium channels. Answer C. Stimulates serotonin 5-HT1B1D receptors. Explanation. Sumatriptan is a 5-HT1B1D receptor agonist that causes vasoconstriction of cranial blood vessels and inhibits trigeminal nerve activation. It is used for acute migraines, but is contraindicated in patients with cardiovascular disease due to its vasoconstrictive effects. 5. A 56-year-old man with trigeminal neuralgia is prescribed a medication that stabilizes inactivated sodium channels. Which of the following drugs is most appropriate? Carbamazepine. B. Gabapentin. C. Levetiracetam. E. Lamotrigine. Answer A. Carbamazepine. Explanation. Carbamazepine, a Na+ channel blocker, is the first-line treatment for trigeminal neuralgia. Side effects include agranulocytosis, hyponatremia, SIADH, and hepatotoxicity. 6. A patient presents with acute status epilepticus. Which of the following is the most appropriate initial treatment? A. Phenytoin. B. Valproic acid. C. D. Lorazepam. E. Topiramate. Lorazepam. Explanation. Benzodiazepines, e.g. lorazepam, diazepam, are the first-line treatment for acute status epilepticus due to their GABA-A receptor activation, which enhances chloride influx and neuronal inhibition. Phenytoin is given afterward to prevent recurrence. A 40-year-old woman is diagnosed with multiple sclerosis and experiences frequent relapses. Which of the following is the best long-term disease-modifying therapy? Baclofen. B. Prednisone. C. Interferon beta paridol. E. Riluzole. C. Interferon beta. Explanation. Interferon beta is used in relapsing remitting multiple sclerosis to reduce disease progression. Glucocorticoids, e.g. prednisone, are used for acute flares. 8. A 68-year-old man with Parkinson's disease experiences severe freezing episodes despite taking carbidopa-levodopa. Which drug can be added for symptom relief? A. Selegiline. B. Haloperidol, C. Amantadine. D. Clozapine. E. Buspirone. Answer C. Explanation. Amantadine enhances dopamine release and blocks NMDA receptors, reducing dyskinesias and freezing episodes in Parkinson's disease. Side effects include livedo reticularis and peripheral edema. 9. A 50-year-old man is diagnosed with Huntington's disease and develops chorea. Which medication can help control his symptoms? A. Donepezil. B. Levodopa. C. Tetrabenazine. D. Phenytoin. E. Gabapentin. Answer C. Tetrabenazine. Explanation: Tetrabenazine is a VMAT2 inhibitor that reduces dopamine release, helping to control chorea in Huntington's disease. 10. A 25-year-old woman with a history of migraines is prescribed a daily medication for migraine prophylaxis. Which of the following drugs is the most appropriate choice? A. Acetaminophen. B. Sumatriptan. C. Propranolol. D. Morphine. E. Naproxen. Answer C. Propranolol. Explanation: beta blockers, e.g. propranolol, metoprolol, are first-line prophylactic agents for migraine prevention. Other options include topiramate, valproate, and tricyclic antidepressants. These USMLE-style questions test key pharmacological principles in neurology. Would you like more in-depth explanations on any